Welcome back to Mama Magic's Lights, Camera, Baby. I'm your host, Projeni Pather, and this is the podcast where we have real conversations about pregnancy, parenting, and everything in between. Now, today's episode is one that I know many of you have been asking for. We're talking about ADHD in children. What exactly is it? How does it show up? And most importantly, what can you do as a parent? Now, my guest today is Dr. Karin van der Merwe. Dr. Karin graduated from Wits Medical School, spent years working in paediatric HIV at the Rahima Musa Mother and Child Hospital, and has been in general practice since 2011. She's currently based in Craighall Park, and she heads up the Gauteng General Practitioners Collaboration, which is a network of 385 GPs who share clinical knowledge and support each other to give patients better care. Now, her special interests are pediatrics, mental health, and chronic fatigue. And today she brings all of that expertise into our conversation. So, Dr. Karin, thank you so much for joining us today, and welcome to Lights, Camera, Baby.
Thanks, Projeni.
Well, let's start at the beginning, right? Share with us a little bit about what drew you to pediatrics and mental health.
So I think for me, it's all about the family.
Mm-hmm.
I would like to see happy, healthy, thriving families.
Right.
And it's my privilege to get involved with families. Whoever the index case is, who needs specific treatment, but also the family at large who needs that support and to help their family member. And I get to walk alongside them and see the families develop and get better. So for me, that is my passion.
Oh, that's wonderful. I think we're going to have you back many times because I think on all your specialities, I can see our parents nodding along. Whether we talk about ADHD, mental health, and chronic fatigue. Again, as parents, it is a juggling act.
Absolutely.
And we wear so many hats. And we hope you will come back and help us with that one too. But for today, let's focus on ADHD, right? What is ADHD? Let's start at the beginning, because I think there's a lot of confusion and honestly a lot of stigma around the word ADHD. So let's explain to our listeners in plain language what it actually is.
Okay, so ADHD stands for Attention Deficit Hyperactivity Disorder.
Mm-hmm.
And I don't like that word disorder. I don't know why they had to make it disorder. They should have made it a condition or a phenotype, in my opinion.
Right.
Because it's just a kind of brain. It's a neurodevelopmental issue. That means the way that child's brain was wired from birth was just slightly different to what we consider normal.
Right.
And so that child then has certain characteristics that another child wouldn't have.
That is so interesting. Now, I also know that I've heard about ADHD and then ADD, right? What's the difference between the two?
So ADHD, there's the attention deficit side, and some children will only have that, and they'll be called ADD.
Right.
And then there's the hyperactive side, hyperactive and impulsive side. We could even have children that just have that, although it's more common to have both, the attention side and the hyperactivity impulsive side.
Okay. Now, are there different types besides the ADD and the ADHD? Because I think a lot of people picture ADHD as little boys and girls bouncing off the walls, but that's not the full picture, right? Like you're saying, there's the ADD part without the hyperactivity.
Absolutely.
Right? So how does it present in children?
So that child that's bouncing off the walls, that's doesn't want to stay in their seat, fidgety, restless, around my office, busy looking in all my things and wanting to play with everything.
Right.
And the poor mother is like, doesn't know where to look and how to control the child. Those are the easy ones to diagnose because they normally have the hyperactivity side of the ADHD.
Right.
And then you'll get other children who will literally just have the attention side. So these are kids that just can't focus. They can't concentrate. They'll struggle to finish a task. They'll only hear the first instruction, not all the long list of instructions the teacher's given. They'll come across as forgetful because they just didn't hear all the things. They might lose a lot of their things some of the time because they just can't remember where they've put things because their mind was elsewhere.
Yes.
And these kids can, if they don't have the hyperactivity component, they can fall under the radar because they don't disrupt. They literally just fly by, looking out the window, distracted. Nobody notices them. But this affects their scholastic, their achievements at school. And it also gives them a very poor self-image. So they often get a lot of anxiety and emotional component as well. More girls have this than the boys. So the boys are more likely, it's not always, but they're more likely to have the hyperactivity impulsivity side. And a lot of girls will be overlooked and only diagnosed quite late with the attention side.
Okay. So, as a parent at home listening to this, what are the signs that would help them to pick up the phone and make an appointment to say, I think that my child, may have this without trying to self-diagnose?
Absolutely. So, all children will have some of these features. And so if your child just, one day can't concentrate on something, it doesn't necessarily mean they have ADHD. But the point is these features need to be pervasive. They need to be around in many different settings. So not only at school, but also at home. And they need to be disruptive. They need to actually be affecting the child's functionality. So when you can notice that child's emotions are not in check or their schooling is not great, the teachers often are the ones who flag the kids that are struggling.
Yes.
Then it's worth getting them checked out. Even a good GP, a good primary healthcare provider would be able to go through a checklist, work out whether the problem is pervasive or not, and then guide the parent in the right direction.
Yep. And again, I think we must reiterate to parents that it's important not to self-diagnose, that this episode, of course, is for education and information purposes only. And it's always best to consult a medical practitioner if you have any concerns about your child. Now, at what age do you think we can start seeing these signs? I mean, because I know some parents wonder, they look at, crawling babies or just, and then as they start to toddle around, is that the start?
Yeah, so it's toddlers by nature are quite impulsive and active, and so it's unlikely that we're going to actually diagnose this in a toddler.
Okay.
The sort of youngest we can start diagnosing with some certainty is sometimes around 4 or 5. But to be honest, most kids are picked up when they go into a formal schooling environment.
Okay. And formal schooling these days obviously starts a little bit earlier, right? So we're talking about from ages 3, 4. We're starting preschools at that age. Would that
so
be?
Sometimes, especially if it's a very structured preschool that's expecting them to sit still and learn letters and things like that, and there's sort of less freedom and play, it might be picked up a little bit earlier. But I'm a little bit torn here because I don't like preschools like that.
Right.
I believe that preschool needs to be a place of play. You learn through play.
Right.
And when they're starting to sort of more formalized education at such young ages, a lot of children will not cope, even if they don't have ADHD.
True.
So I think around 5 or 6 would be a better time to start really diagnosing these things.
Now, what about the child that seems to cope at home, but they fall apart at school, or vice versa?
Yeah, so as I said, the characteristics should be pervasive, but in some senses, there are certain children who do better at school. And those are the ones that are very intelligent and they manage to pull themselves together, pull themselves towards themselves and get through the school day. But by the time they get home, they are exhausted. They are just an emotional wreck. So that's the one type.
Right.
And then the other type is they might find that because school is more structured, at school they can't function, they can't concentrate. But as soon as they're at home where there's a more free environment, the problems are less evident. So it can kind of swing both ways.
Okay. Now, if a parent suspects that a child has ADHD, where do they start? Who should they go to first?
I think a primary healthcare provider is the way to go. So, a GP would be a very good starting point. As GPs, we're also taught to check for other things that could mimic ADHD. Children that can't hear properly, for instance.
Oh, really?
So just basic things like hearing checks and visual screens, make sure they can see.
Yes.
Those types of things also make quite a big difference. They can also check, the emotional side. Sometimes it's an emotional thing that's causing children not to be able to concentrate. So you can have ADHD causing anxiety, but you can also have anxiety causing concentration problems. So start with a primary healthcare provider, someone who's a bit more general. Some GPs are quite adequate in treating ADHD if that's an interest of theirs, or they might refer you to another GP, or they might refer you to a psychiatrist or a pediatrician, an educational psychologist. So the GP is quite well placed to then send the child in the right direction.
Perfect. I love what you said there. That's so interesting. I mean, we're so ready to diagnose because it's become such a common term used. And I think as parents, we start to be on high alert because there are other children in the class. There's other friends in our social circle that have children that have been diagnosed, and you start to look for those clues as well. But what you're saying right now, I think a lot of parents don't take that into consideration. I mean, it could be a side thing that could cause the disinterest, right? It could be the hearing thing that could say, you might wonder, why is this child so distracted and looking all over the place, but they cannot communicate that this is what they aren't seeing or aren't hearing. So as a teacher, I suppose you have to be very alert as well to be able to share that kind of information with parents. Right? Because it's a whole little village going on here behind them. So, okay, when we take the children for an assessment, what does that actually involve? Is it a blood test? Is it a scan? What happens?
Okay, so no, there's no blood test and there's no scanning involved generally. We use a very detailed history to get symptoms. And we often use questionnaires. So we might send a questionnaire home to dad to also answer. We might send a questionnaire to the teacher to answer.
Okay.
And there's all very validated scoring systems to work out, whether the child fits within a normal scale or in a ADHD type phenotype. Yeah. So it's mostly history and examination. There's no scans, no blood tests, you'll be happy to know.
Okay, that's great. So there's a lot of information that you need about the child's, and those questions are obviously about the child's behavior through the day.
Yeah, so there'll be lots of questions about behavior, about whether they can sit still, whether they fidget, whether they're impulsive, whether they can wait their turn, whether they interrupt others, whether they blurt out answers, talk excessively, are always on the go. So there's really a long list of questions.
Okay, so you need time to answer that.
Yes, it needs to be really thorough.
Yes, and obviously you're not getting it from one individual. You're asking the school, you're asking mom, you're asking dad, possibly the caregiver, the home as well. So you're putting all that information together to make that assessment.
Absolutely.
That's great to know. So let's talk about treatment, right? I think there's a lot of fear for parents because they just think when someone says medication, it feels like a very big step. So is that all it is, medication, when you're diagnosed with ADHD? What do you need?
No, absolutely not. Not just medication. Like you said, it takes a village to raise a child.
Yeah.
And so the whole village has to get involved. Parents can really benefit from some techniques, things like giving children a lot of structure, a lot of routine, also validating the kids, making them feel they've done something well, because often they're the ones that are always hearing that they're not doing things well. And then good communication with the teacher, whether that be maybe a letter from the medical team or even a phone call between the teachers and the doctors, some suggestions to help the child in the school environment. They may need a bit of extra time. They may benefit from sitting in the front of the classroom next to a particularly organized learner who will
Motivate
keep them in track,
Yeah.
And then onto the medication side, there are excellent medications available. My motto is start low and go slow. So we really get to see how the medication is impacting the child, and it must be a positive impact. As soon as the child is not feeling good on the medication, or maybe a little bit switched off, that means that medication is not right. We might need to change it to another one. We might need to change the dose. So we take all of that into account, and communication is really key.
Well, it sounds like a really holistic approach, right, to managing it. You're talking about medication and working with the school, working with the parents. Does additional play therapy or help as well?
Absolutely, yeah. That I should also have mentioned.
Yeah.
So these children, they often have a lot of emotional issues as well. It goes hand in hand. And so something like play therapy or child psychologist is absolutely key. Even sometimes a good occupational therapist who can just help that child understand themselves as a kid living with ADHD and coping strategies on how to live day to day. And you'll get some children who will even get away without medication with the other support in place. It just depends on the child.
So that's quite interesting to note that it's not medication alone, and the holistic system helps, and some actually could get by with all these other systems that we could put in place to help them cope better. Now, what could parents do right now, even before they have a diagnosis? So they might suspect, could they start putting some of these other support measures in place to see how that goes before the diagnosis?
If they've got a bit of a delay in seeing a healthcare professional, they could just try things like a very structured home environment, and clear instructions, one by one to the child.
Right.
One thing they must also remember is things, just the basics, like sleeping well, eating well, exercise. Sleep particularly does affect attention. All of us, if we don't sleep enough, won't be able to pay attention. That's a known thing. And then another interesting one is screen time. So there are studies that show that children who have more than 4 hours screen time a day definitely have attention problems. Now, that's quite an extreme. I hope 4 hours everyone's thinking, wow, that's a lot, because to me, that's a lot. But there is a correlation between screen time and attention. So limiting screen time, particularly just before bed and things like that, I think is a good idea.
Okay, yeah, that makes sense. And it's some simple things that we can activate at home. It's simple things like you're talking about the structure. They need more structure. Now, a lot of people talk about ADHD as a disorder, right? But you've often said that it's just a different way of thinking.
Yeah.
Right? So we often hear these challenges like, poor concentration, impulsivity, but there's some positives to that as well. And what are they actually strengths associated with that? Because we always see it as negative, right? It's doomed, like what do we do now? And we go into a panic. But there's some strengths associated with this.
Absolutely. That's why I don't like the disorder part of ADHD. Yes. Because ADHD can also be a superpower.
I love that.
It can. And what you're going to find is they're often very creative, out-of-the-box thinkers, can come up with solutions no one else would ever have thought about or contemplated.
Wow.
So in a creative environment, can do extremely well. Energized, enthusiastic, spontaneous. We need people like that.
We do.
All those things are strengths. Also quite empathetic emotionally, because they're quite perceptive of emotions.
Right.
And this is also why, people say, well, do you grow out of ADHD? I don't know whether you completely grow out of it, but I do think that if you can get into an environment one day that suits your brain type, you might not need your medication anymore because you're in an environment that you can then thrive in. Or you might just use an odd medication when you have a really tough meeting or something. So that's also possible.
Wow.
So yeah, I think ADHD can be a superpower, and we mustn't just think of it as a disorder.
Yeah. So more out of the box thinking, that's what you're saying. That's it, because they're so creative through those moments. Wow. That's an amazing strength. And I love the fact also that you talk about that hyper focus that gives them that opportunity, unlike other children, to be so creative because they're so hyper focused, they're thinking out the box, all of these things. I love that.
So the hyper-focus part is a bit difficult to understand. What my patients say to me is, but how can you have ADHD when he's playing such and such a video game? He is completely enthralled for hours.
Yeah.
The difference is with the brain structure with ADHD is that hyper-focus is possible when they're being rewarded for what they are actually focusing on, something they're intensely interested in. Their brain almost switches to the totally distractible version to the hyper-focus version, and then they will completely zone into that core interest. So you can imagine if you do find that career one day, which you're absolutely fascinated by, your hyper-focus could be a strength.
Wow. And that goes back to what you said earlier about children like this needing the validation. I mean, children always need validation, but these children particularly need more validation.
Absolutely.
And I suppose the hyperfocus, the reward comes with that, validates what they're doing, validates, the work that they're doing, whether it's in a game or in schoolwork, and it pushes them even further. That's really interesting. It's just the opposite of what people expect of this condition. Now, what about energy levels now when we talk about ADHD? Is it always the same with everybody?
Not with everyone, but in the hyperactivity subgroup or those that have those symptoms, they will tend to have higher energy levels.
And is that a strength? Would you categorize that?
I wish I had higher energy levels. I think a lot of us wish we had higher energy levels.
Absolutely.
So, it is a strength. So being able to sort of pull an all-nighter, for instance, without it being as much of a toll on one as the usual people.
Yeah, I mean, that could be a huge advantage, right, in the right setting.
In the right setting.
Yes. And I've also heard people say ADHD individuals can be quite intuitive.
Yes, correct. So they tend to be quite empathetic and intuitive. They're normally quite emotionally wired, so they can sort of key out that other people are also feeling in such a way, or that a situation is going in a certain direction. So that's quite a good strength as well.
I would say. And let's talk about the emotional traits. Are they always highly emotional?
Oh, never say always in medicine, right?
Okay.
But they tend to be quite emotional. I mean, the thing is, I think when you've struggled your whole life to keep up with your peers and do what the other kids are doing, it takes a toll on one's emotions.
Yeah,
They often get anxiety or depression because of that.
Yeah. But at the same time, they can also connect quite deeply with others, right? Because they have they're intuitive, the hyperfocus is there.
Yeah, so they will be able to use it as a strength as well. So, I think anybody who's experienced anxiety or depression gets a deeper understanding of human emotion and is more empathetic. So it's not only the ADHD, but they often will have had that. Yeah.
So there are so many positives here that I think many parents don't realize about children with ADHD as well. But I imagine, obviously, the context matters, right? So without that, I suppose all these traits can come with their difficulties as well, right? So now we looked at the strengths, but there's also the challenges that come with it, right? And it's about seeing the full picture for parents as well. So how would you advise parents find the balance between the challenges and the strengths that these children present, being ADHD?
I think the thing is, it's all about the environment you find yourself in. So a structured school environment is maybe not the easiest place for a kid with ADHD. So they're going to need extra support, whether that's medication or all the other support systems we've spoken about. But that doesn't mean they can't thrive in that environment, just with the extra support that's available.
That is true. It's nice to know that we have come such a long way in terms of support for this condition, that parents don't need to be fearful. And it's about just having the diagnosis and setting up the systems and routines, like you're saying, to help your child thrive. So I want to do now a quick myth bust with you about this condition. So I'm going to throw some things at you that I think parents hear all the time, and we just want your honest opinion. So the first one is that ADHD is just bad parenting.
Now that's a big myth.
Yep.
There are many wonderful parents who've done everything right and they still have kids with ADHD. So that one's busted.
Okay, because it's not like you're saying, it's not parenting. It's a condition that you're born with, right?
Yeah, your brain is wired differently from birth, and very bad parenting could make things a lot worse, but it's not bad parenting that causes the condition.
Okay, let's go to number 2. My child can focus when they want to, so they can't have ADHD.
So that's where that whole hyper-focus comes in. If they're doing something that's particularly rewarding in their setting, they can focus. And that is a well-known thing about ADHD, the hyper-focus.
Yeah.
But that doesn't mean they don't have ADHD. Because when there are other tasks that need to be performed, because unfortunately we all live in the world where we need to get things done, then they struggle.
Yeah. And this multitasking world that we live in can be quite challenging for just about everybody, right?
Sure.
The next one is medication will change my child's personality.
So in the right hands, if a doctor's treating a child properly, if there are personality changes or the child seeming a bit dopey or switched off, then that is not the right medication. It's not the right dose.
Okay.
So if you are on the correct medication for that child, it should not change their personality. They should still be the normal child that they always are, just being able to concentrate, being able to focus. What really I love is when I have children who come to me, small children, and they say to me how much they love their medication because it's just helped them so much.
Oh, that's beautiful.
Yeah. So
that is really beautiful.
Even the kids realize when it's the right medicine for them.
Yeah. And again, it's that deeply intuitive nature that is allowing them to understand the differences it makes to their lives, right?
Exactly.
Wonderful. And then what about this one? They'll grow out of it.
So that's what I was saying, is that ADHD does tend to get less of a problem as one gets older. So there's 2 schools of thought, but the one that I subscribe to is that your brain is still going to be wired like someone with ADHD forever. That's not going to change, right? But you're going to find yourself in an environment that you can cope better with having those traits. Plus, the brain does grow and develop in some senses so that you do have a little bit more resilience, can we put it that way, in terms of coping with the world. So there are many adults who struggled quite badly with ADHD as children, but as they have got older, they've been able to cope much better.
So the coping strategies are in place and for many years, and I suppose you know how to draw on them as you get older.
Exactly.
Well, right?
Exactly.
Okay. What about this one? Sugar causes ADHD.
Now, that's an interesting one. I mean, I know with my son, when we gave him sugar, he used to bounce off the walls.
Yes.
But he didn't always bounce off the walls, only when we gave him sugar. But there's absolutely no evidence that sugar causes ADHD. In other words, the neurodevelopmental condition of ADHD.
Yeah.
They've really studied that one really carefully, and there's no link there.
Absolutely. So, I mean, it matters for general health, I suppose.
General health, yes.
Yes.
And some children do get a little bit more wired when they've had some sugar, but it's not the cause of the ADHD.
Yeah, absolutely. Well, thank you for busting those myths for us. I hope you've all listened carefully. So, I think I want to take a moment now to speak to the parents who are in the thick of it right now. I mean, are the ones who are exhausted, who feel like they're failing, and they've had the calls from the teachers and the meltdowns at homework time. What do you say to them during this process of trying to manage their child with this condition?
Yeah, it's tough. It's really tough to be a parent in that situation. Often feel very alone. Sometimes they feel guilty, which we've said they shouldn't feel guilty, but they do. And they feel a bit helpless. But there is help. Someone like your GP or primary healthcare facilities, especially if they are pediatrically minded, they're very well equipped to deal with this kind of thing. So reach out if you need help. And there is support out there for parents.
There are support groups as well?
I'm sure there must be. I need to look into that.
I know that there is the ADHD Association
Yes.
out there as well, that offers additional resources as well, in addition to your general practitioner. And I mean, I think there's also a lot of guilt for parents, right? There's all this talk, like we talked about earlier, did I cause this? Could I have done something differently in my parenting? What do you say to that?
Yeah, I think that guilt is so misplaced. I always say guilt comes with the placenta. Mothers are so prone to feeling guilty about everything.
That's true.
When they've had a child. And most mothers are the most wonderful, loving, selfless creatures. And so, yeah, hopefully that's been debunked today, that it's not a parenting style that causes ADHD.
Yeah.
That you really can get help and support, and that you shouldn't be taking all the burden of guilt on yourself.
Absolutely. And I think you've talked a lot about creating the structure and creating the system, a consistent system at home and at school that allows your child to thrive better, right? So it's about how you parent going forward.
So that will help. But I think, don't think that, oh my goodness, if I'd done that all along, my child wouldn't have ADHD.
Okay.
You know, your child's brain is wired like that from birth, whether you did that or not.
Okay.
So those are more just things that can help as you go along.
Right.
But they're not causative.
Got you. Well, Dr. Karin, I think, but before we wrap up, this has been a very interesting conversation and I've learned so much through the process. But what would be the one thing that you want every parent listening today to take away from this conversation?
Well, I think this whole thing that ADHD is not a disorder. It's just a different way of thinking. It's a phenotype. It's pretty common. 5% of children have ADHD. So not to sort of think of it as the worst thing that could ever happen to your child, to know that there are resources out there, there's help out there to help your child cope in the very structured environment of school, and that one day they will use their ADHD as a superpower.
Oh, I love that. Especially going through all the strengths of a child that has ADHD, I think we need to lean into that and provide that validation for our children again. And I think we sometimes get so busy as parents, we forget to do that as well. So if our parents want to reach out to you, where could they find you?
So probably the easiest is my website is drkarinvandermerwe.co.za, and all the practice details and everything are on there.
Wonderful. And we'll drop that in our notes, in our show notes. So moms and dads, you can find that there. And lastly, just thank you so much for giving us your time today. I think this has been such a grounding, honest conversation, and it's exactly what our community needed. So to all our listeners, if this episode has helped you, please share it with another parent who needs to hear it. I mean, I think that is the biggest gift you can give to them and to us. And you can find us on Apple, on Spotify, and on YouTube, as well as the Mama Magic website. And if you have a topic you'd love for us to cover in the future, please drop us a message. We promise we will read every single one of them. Until next time, keep asking the big questions and join us again on Lights, Camera, Baby.